Thank you very much, Police Band. And then you may kindly relax now. We are almost going to start the program. And any moment from now, His Excellency the President will enter the hall. And as he enters the hall, we kindly rise to receive him. And when he gets seated, then we will go straight into the program, where we start with the National Anthem. Then after the National Anthem, we have the prayers from the religious leaders. And then we have the welcoming remarks by myself, and also there'll be a presentation according to the guide in front of you. And after the presentation, there's going to be remarks on the role of partnership and collaboration by the Chief Executive Officer of Defeat-NCD, Dr. Mukul, and his team are all here. Welcome. After we have been talking, and then on board video and others, for today, finally, we have seen each other. Thank you, and welcome to the Gambia, Dr. Mukul and team from the Defeat-NCD. We also have presentation on the importance of partnership, where we have the presentation by the WHO country representative. Then we also have experience sharing from the Republic of Djibouti, from the Minister of Health in Djibouti. We have a representative who is also here with us, who is going to give us a presentation to share the experience of NCD prevention and control in Djibouti. We also have remarks on the role of international development partners and their efforts. This is already a pre-recorded message from the World Diabetes Foundation. World Diabetes Foundation is also a partner towards NCD prevention and control in the country, and the Gambia has benefited from their projects, so we'll be happy to hear from them. We also have keynote address. That's the final part of the statement of the program by His Excellency the President. And also we have the handing over of the strategy plan and the costed action plan from the Paramount Chief to the Honorable Minister, Honorable Ahmed Lamin Samade, for onward transmission to His Excellency the President. And that will mark the end of the first part of the presentation, and then we go into the second session, which is going to be a panel discussion. This is about 30 minutes, and also we have another session again, which we're going to have photo session plus press briefing. And then for press briefing, I am sure we will allow the honorable ministers that are present and to lead, to move on together with His Excellency the President. Then we will stay whilst they go back to their offices. Then we'll continue with the panel and the press briefing, where we'll be discussing some issues around the achievements we have registered as a country and also as partners, and also what experiences we can learn from other countries within the region, the African region, and also outside the African region. So that will also be one of the items on the agenda. So we have two important components of this exercise. We have the official opening ceremony, followed by second session, which is going to be panel discussion. And the third one will be the press briefing. We will try as much as possible to make this ride very simple and short, in as much as we can, so that people can really go back to their offices because they've been sitting here for a while. It's a promise. We will try to go according to the program, and we ensure we move onto the program, exactly onto the program, onto the guide, so that people can have time. But this first session will be moderated by myself. My name is Modou Ndiaye, Director of Health Promotion and Education at the Ministry of Health. And the second session, which is going to be the panel discussion, together with the press briefing, will be moderated by my namesake again, Modou Ndiaye, who works for the Gambia Radio and Television Services. So the Ndiayens have control today. So if you are Job, Seka, or otherwise, well, we are in control today. Thank you very much, and good morning, and welcome to the program. His Excellency is now entering, and as I said, we can kindly rise to receive him. Thank you. Thank you very much, Police Band. Your Excellency, President of the Republic of the Gambia and Commander-in-Chief of the Armed Forces, Mr. Adama Barrow, welcome to the Sadada Karaba International Conference Center, where you are gracing the occasion of the launching of the National Multi-Sectoral Strategy and Costed Action Plan for Non-Communicable Disease Prevention and Control in the Gambia 2022-2027. Your Excellency and delegation, welcome to this important event, and we are happy to have you here. Before we go into the program, Your Excellency, with your kind permission, we may kindly rise for the National Anthem to be led by the Police Band. Thank you. You may kindly get seated, Your Excellency. Thank you very much, Police Band. I now have the honor to invite Imam Ibrahim Cham to lead us in the Muslim prayer. Imam Ibrahim Cham.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب يا رب بالذات وبالصفات فلتكن لنا في سائر الحالات ثبت قلوبنا على الإيمان ولتهدنا لعمل الإحسان وانظر إلينا وانصرنا دينا أد حقوقنا وأد دينا وهب لنا ذرية مباركة تكن لله بلا مشاركة وجاز عنا كل من قد أحسنا إلينا يا رب جزاء أحسنا بالمصطفى الشفيع يوم المحشر خير الورى من جيء بالكوثر صلى عليه ربنا وسلم وفاض بالخير لنا وعمما وفاض بالخير لنا وعمما وفاض بالخير لنا وعمما بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك اللهم صل على سيدنا محمد الفاتح لما أغلق والخاتم لما سبق ناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله حق قدره ومقداره العظيم سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين على بركة الله.
Amen. May Allah accept all the prayers, and thank you, Imam. I now invite Father H.N. Colley to lead us into a Christian prayer. Father H.N. Colley, kindly come forward.
In the name of the Father, and of the Son, and of the Holy Spirit. Our help is in the name of the Lord, who made heaven and earth. Almighty and ever-living God, we thank you for this day. We thank you for our lives. We thank you for bringing us together in your name. As we gather as a nation in ways of controlling and preventing non-communicable diseases, we pray that you may send us your spirit to be our guide. Send us your spirit of wisdom and understanding, so that all we do here may be for the glory of your name and for the benefit of our beloved nation, the Gambia. Direct our minds and hearts so that we will not look only to our own interests, but the interests of the general good, our beloved nation. For these and all other mercies we ask through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen. May Allah accept the prayers. Your Excellency, the President of the Republic of the Gambia, and Commander-in-Chief of the Armed Forces, Mr. Adam Barrow, the Deputy Speaker of the National Assembly, the Honorable Minister of Health, Honorable Ahmed Lamin Samate, and his colleague cabinet ministers are present, the Deputy CDS, the CEO of Defeat-NCD, WHO country representatives, UNICEF country representatives, UNDP resident coordinator, religious leaders here present, senior government officials, the Secretary General of the Civil Service, and also the media here present, colleagues from the Minister of Health, and all partners that are also present here today. I want to say good morning to all of you and welcome to this important event, which is indeed historic for the first time in the history of the Gambia, that we are launching today a national multi-sectoral strategy and cost introduction. Chapter 2 is the common Ncds in the Gambia. We have so many non-communicable diseases, but as you go through, you'll be able to know the different types of Ncds in the Gambia, in that particular chapter. Chapter 3, we have the risk factors for Ncds. There are so many risk factors, but key among them, those are the ones we're going to discuss, and they're also highlighted in this particular area. We have the socio-economic impact of Ncds in the Gambia. It's also an area that will also be, has been dealt with in this particular document. The SWOT analysis section that describes the strengths, the weaknesses, and as well as the opportunities and threats with regards to the entire process has also been highlighted in this document. The strategic plan for Ncds, that's in Chapter 6, and Chapter 7 is a national costed plan. Attached to the strategy, there is a national costed plan that is also been attached to the document. That's the 7th chapter. Your Excellency, this important document, as I said earlier, is a very important document, and it's also a historic document that has 6 strategic objectives. One of them is to raise priority for NCD prevention and control at a national, regional level through strengthened collaboration and advocacy. And then the PowerPoint will also be projected.
Where's the computer? Thank you very much. Yeah. His Excellency, the President of the Republic of the Gambia, Mr. Adam Barrow, colleague cabinet ministers here present, the Deputy Speaker of the National Assembly here present, the head of the UN agencies and all the UN agencies here present, the Defeat-NCD Partnership Director, Dr. Mokul, and his entire team, Leal, and all the members here present, senior government functionaries, the Secretary General, Security Chiefs, the Paramount Chief, distinguished ladies and gentlemen of the media, all invited guests, we are once again delighted to stand in front of you. I've been asked to give a presentation, Your Excellency. It's a technical presentation. It's a little, not the norm, but they said to me, because His Excellency is going to be here, so we thought you should present. I say, well, what can I say? So I'm going to do the technical presentation bit now, and I'll try my best at it. Excuse me, where's the door? Look at the computer. Well, I need to see what I present. But we need to see too. facilities pretty late with complications of NCDs, whether it is hypertension, presenting with hypertensive heart failure, other cardiovascular diseases. If it is diabetes, they may present with complications of diabetes, renal failure, diabetic foot, blindness, and so many other complications that arise from NCDs. Stroke is the 5th cause of mortality in the Gambia. 1/5 of all the deaths in the Gambia are caused by strokes. Unfortunately, we've been seeing increasing number of cases of cancer in the country. In 1990 and in 1988, 275 cases were detected. Now this has been steadily increasing, and in 2020, over 1,000 cancer cases were detected. Now, there could be multiple factors resulting in this. Of course, our ability to detect cancers is also improved. However, but we think there is an actual increase in the number of cancer cases. Our focus as a country is to increase early detection, to improve treatment coverage rates, and also improve the quality of life. With most of the diseases, early detection helps. Even with the cardiovascular diseases, with diabetes, a good control, using medication, dietary control do help. And with cancers, quite a lot of cancers are completely treatable if they are detected early. Now, unfortunately, we've been seeing increasing number of asthma cases as well, even though this is actually, we believe, just the tip of the iceberg, which is very cumbersome, very expensive. Quite a lot of these patients would have had diabetes or hypertension. So we see a whole lot of complications as a result of these NCDs. It is equally estimated that the prevalence of high blood sugar in pregnant women is also another factor that leads to a whole lot of complications in the newborn, and complications that probably, yeah, but the other screen is not working. It has come back. Complications also leading to an increased level of maternal mortality. Our vision is to attain a Gambia free from avoidable burden of non-communicable diseases. The mission statement is to apply a multi-sectoral approach to mitigating the burden of NCDs, reducing premature mortality, and ensuring a healthier population. The goal is to reduce by 1/3 premature deaths from NCDs in the Gambia by the year 2027. Our guiding principles are a multi-sectoral approach, a life course approach, human rights approach, equity-based approach, whereby there is empowerment of individuals, families, and communities, an evidence-based approach as well, and integration into the existing health systems, and of course universal coverage, because all people need to be covered, whether they are able to pay or not. This is very important, Your Excellency, distinguished guests, ladies and gentlemen. The fact that we are launching the National Insurance Scheme very soon is a big plus in our collective efforts to provide universal health coverage for the people of this country. And gone are the days when we depend on anecdotal information. We want to do whatever we do based on scientific evidence that justifies the funds that are spent on dealing with diseases and the preventive strategies as well. And of course, the involvement of the communities is very important, because whatever we do, the sensitization, especially with NCDs, quite a lot is because people do not know what they entail, they do not know the risk factors, and they do not know even the early onset of complications when they start. So engaging the communities, that's going to be a pivotal point in our strategies to deal with how far we have gone with those. Now, health promotion, as I said in the introduction, and education are very important. Most of the NCDs, the risk factors, that's why they are called lifestyle diseases, because most of them, sedentary lifestyles contribute, the diet contributes, smoking contributes, overconsumption of sugars contribute. So all those are lifestyle issues that with health promotion, adequate health promotion, we'll be able to prevent most of these diseases. Now, prevention and control strategies are equally important, and they form the fourth strategy. And this is going to be through a people-centered approach, participation at all levels, especially in the communities. We want to, very soon, Your Excellency, will be bothering you again with other launchings. And this time around, we're going to launch community pioneers, role models in the communities that are going to be aligned to each of these diseases. For example, Bakau, if we have an NCD focal person, a person who will be for NCDs, person for COVID, person for malaria, and so on, this will empower the communities, and it will give them some responsibility that they themselves are ability. Now, the strategic actions, we want to strengthen advocacy and strategic engagement of stakeholders for the prioritization of NCD prevention and control. Well, the expected output for that, we hope to improve prioritization with increased funding for NCDs, and the indicators will be number of advocacies and strategic engagements conducted, percentage increase in domestic funding for NCD prevention and control, and percentage increase in external funding for NCDs. The indicator measurement will be dependent on the annual MOFIA reports on increase in NCD funding allocation, both domestic and external. To the chair of the multi-sectoral committee, we're going to form multi-sectoral committees that are going to coordinate that. And the baseline expenditure annually is expected to be $6 million US. And the target is $12 million US. And the lead agency in this will be Ministry of Finance and Economic Affairs, and the partners will be Ministry of Health, the World Bank, the UN agencies, the National Assembly, and civil society organizations. Whatever intervention we do, we expect it to be beneficial. Without that, there is probably no need to have interventions. So what do we expect to gain from these interventions? So the expected impact of the national strategy and costed action plan over the next 5 years. We'd like you to know that nearly 1,000 deaths would be averted by the implementation of this plan as compared to the status quo. These would be driven primarily by risk factor reduction, hypertension management, and cardiovascular disease treatment. The diagram on the other side shows you the number of deaths that would have been averted if we are able to act in line with the strategy. If we do not do anything, you can see 2022, the baseline. If we do not launch this strategy, if we do not get funding for it, there would be no increment. But if we, after launching this, if we're able to get funding for it for the implementation, in 2023, we expect over 3,000 healthy, we expect to save over 3,000 lives by using the ambitious program. So what we have, the strategy is divided into three. We have the ambitious costing, and we have the prioritized costing, and we have the status quo. So the ambitious costing, if you use that, we would have saved much over 3,500 lives in 2023. If we use the prioritized strategy, prioritized costing, we would have saved over 2,500 lives, as the graph shows. So certainly it is better to get as much funds as possible for the ambitious costing, but also considering the fact that there are quite a lot of challenges worldwide. The COVID-19 pandemic came, and the current economic challenges being faced by all the countries in the world. We thought it's important to also have what we call a prioritized funding. So the figures are different, and you'll get to see earlier. But each of these funding models actually has an impact on the total number of lives we would be able to save as a country. So certainly, if at the end of the day, we get the good news that some people are willing to fund the prioritized or the ambitious one, we'll even be happier. So this shows the summary of the costing models. I was trying to get better, but without funding, it's very difficult. Now, the interventions we hope to carry out with these funds, we're going to deal with the various disease entities. Cardiovascular diseases are going to consume 25%, diabetes 34%, chronic respiratory diseases 16%, liver cancer 8%, prostate cancer 4%, breast cancer 9%, and cervical cancer 4%. Of course, we all know by now that there's increasing burden of the cancers. We've seen a whole lot of cervical cancer in this country, a whole lot of breast cancer and prostate cancer. And it is important to also know that quite a lot of these funds are going to be invested in the screening programs. Cervical cancer, when detected early, is completely treatable, or when you detect the precancerous lesions, is completely treatable. And it is the leading cancer. Out-of-pocket expenditure has been pretty high in our country, which is typical in many of our developing countries. In as much as people spend quite a lot from their pockets when it comes to healthcare, but I must tell you, probably Gambia offers the best when it comes to that, because we've been in many countries where everything, even cotton wool, syringes and needles, plaster, of course you will not talk about medications, are bought by patients whilst they're on admission, and they pay. In fact, we've seen countries whereby the public sector even charges more than some private facilities. So in Gambia, the consultation fee of $25 is, and thereafter patients go to the pharmacy to receive any medication, just any, that would have been prescribed for them. It's exemplary, but of course sustainability becomes a problem, because that means the government has to spend a lot of resources on the provision of healthcare services. Fortunately, the health insurance will go a long way in helping us deal with that, so that the out-of-pocket expenditure goes down to zero, so that people do not have to bother about getting funds. When they have illnesses, they can run to the hospital immediately and try to get treatment for themselves. The funding gaps for prioritized NCD needs. So we decided, as I mentioned earlier, to select the prioritized group, but even with that, there are quite some funding gaps. We can see from the diagram, we've seen the 2022 figure. Now, but we have seen that gap that is shown there. So the suggestion is, and we are happy the GRA DG is here. The suggestion is, if we have additional role in the reduction of NCDs here, and it is renowned all over the world. As I mentioned earlier, 5% of tax revenue from tobacco products will be directed towards NCD funding, with matching taxation on sugar sweetened beverages. We also want to shift focus from treatment to prevention, as most of these are preventable. And by so doing, we need to engage the communities. We are happy the Paramount Chief is here, but we're going to be very active as a ministry in our community engagement strategies so that the message gets to the actual people in our communities. We also hope to engage the partners in getting cross-sectoral, cross-thematic funding so that where there is potential overlap, where activities that may not be seen to affect NCD control and prevention, if there is linkage, you realize that a whole lot of these are linked. An example is dealing with COVID-19. I think COVID-19 funding certainly will be very the successful implementation of this costed strategy. Once again, I thank you very much for your kind attention.
Thank you very much, Honorable Ahmed Lavin Samate, for giving us that highlights of the entire strategy and the costed action plan for NCD prevention and control in the Gambia 2022-2027. I now move on to the agenda. We have now remarks on the role of partnership, collaboration, and coordination across partners in the Gambia and other countries in the region and beyond to scale up efforts in addressing NCDs. This is going to be presented by the Chief Executive Officer of Defeat-NCD Partnership, Mukul. You are kindly welcome to the podium. Yeah. Yeah. Okay. Thank you, Mukul. You're also welcome.
Thank you, His Excellency President. Serve as lessons for other countries. I'm very pleased to see that we have our learned colleague from Djibouti, which is in the Ministry of Health. Djibouti has just recently taken over the World Health Assembly presidency this year, and in my discussions with the Minister of Health a few weeks ago in Geneva, he was very committed to doing a similar exercise which we're currently embarking on in Djibouti. So not only is Gambia leading on this as an example in the country, but it's also providing a lessons right from the start, as you can see, for other member countries. So Excellency, really congratulations on this. As colleagues have mentioned, over the past year and a half, Defeat-NCD partnership has provided technical assistance to the Ministry of Health, and we're now proud to see that over the past, well, your participation, but over the past year we've recorded a 14% increase in the number of NCD patients with access to health facilities. And in addition, the willingness to use health facilities has increased by 52%. My team is here today, and we're here for the entire week, and we look forward to a series of meetings that we've already set up with the relevant line ministries to take forward the next phase of the work over the next 5 years and beyond. The current available funding for NCDs in Gambia is not sufficient, as we've said, and the funding gap, which the Minister of Health alluded to, for prioritized activities is estimated to reach $5 million by 2026 and 27. Due to this priority that we're placing on tackling LCDs, we can, you can see, a sustainable funding solution developed and integrated into the strategy document. This scenario incorporates the new scenario below, assumes that 5% of tax revenue from tobacco products will be directed towards NCD funding, with further assumption that taxes on sugar sweetened beverages will be levied to match it. With this additional tax revenue, the funding gap would be reduced for the prioritized scenario in implementation of the strategy. So I look forward to
NCD partnership representatives here, and a representative from the Ministry of Health of Djibouti, media representatives, distinguished ladies and gentlemen, all protocols duly and respectfully observed. It's my singular honor and privilege to be at this launch of this historic stepping stone towards addressing the scourge of non-communicable diseases in the Gambia. Each year, non-communicable diseases kill about 41 million people globally. That's equivalent to 71% of all deaths worldwide. It's more gut-wrenching to know that 77% of these deaths occur in low and middle-income countries. Because of this staggering death toll, Your Excellency, your presence at this important gathering is very, very crucial. Your presence is signaling to your fellow Gambians, as well as to the global audience, a commitment to tackle this burden of NCDs head-on. Today, there is a growing consensus amongst the public health experts, the public health policy specialists, that has yielded fruitful results for the country. The Ministry of Health, with the Ministry of Health leadership, as was highlighted by Honorable Minister of Health, tobacco control regulations in the Gambia is yet another example of successful partnership across multiple sectors with wide range of stakeholders' involvement. I recognize the presence of the Commissioner of the GRA, who was very instrumental in this. I would like to recognize your contribution to that also at this moment. Thank you very much, sir. The Ministry's multi-sectoral committee on tobacco control served as a springboard for several tobacco control initiatives. It has not only generated a new stream of income for government, but also directly contributed to lowering the usage of tobacco and tobacco-based products by the Ministry of Health alone. Because the risk factors like tobacco use, harmful use of alcohol, unhealthy diet, physical inactivity are outside the health sector's control. That's why the United Nations General Assembly in 2011 adopted with consensus a resolution entitled Political Declaration of High-Level Meeting of the General Assembly on the prevention and control of non-communicable diseases. NCDs prevention control needs all sectors' action. Allow me to cite just a few examples to illustrate this fact. Let's take cardiovascular disease, which is a major killer in many of the developing world countries. And if we take unhealthy diet, which implies diagnostic and treatment services, which is the last resort, which we don't want to go there. We can avoid most of the NCDs by doing the right thing at the right time. If I take physical activity, I think our modern life has resulted in us driving to work, go and sit in the desk the whole day in meetings and then different activities, but which doesn't need much of physical activity. We drive back home, we sit in front of the TV listening to the news and so on, eating dinner, back to sleep. And we don't have opportunity to exercise unless we make plan for that. So education can help us in promoting this physical activity from school age, at school level. That can lead to healthy lifestyle that will stay for the rest of our life. Ministry of Sports can promote also physical activities through education and various mass sport activities. Excessive cost needed for treatment. We do not want to lose our productive population to NCD, neither we are ready to pay the heavy cost for our inaction. Hence, we have no choice but to forge ahead and put into action what is in the multi-sectoral plan by contributing our share with determination. The World Health Organization is ready to play its role towards the Gambia's effort of attaining the SDG target of reducing by 1/3 premature mortality from non-communicable disease through prevention and treatment. The Gambia has experience, as I highlighted, and the resolve to make this possible and achieve the SDG targets. I thank you very much for your kind attention.
Thank you very much, Dr. Desta, for those examples. And I'm sure we are happy to have our partners from the Work for Health. They're also here, and we work together with them very closely. We're also happy to have some act, and the regulation is really compared to none in the African region. Thank you very much. We now have this statement by our colleague from the Minister of Health in Djibouti, Dr. Dakhar Abdul Karim, who will now share their experience with us with regards to our NCDs in Djibouti. Dr. Abdul Karim, you're welcome.
Thank you, Mr. Bonjour. His Excellency, Mr. President Adama Barrow, Honorable Speaker of the National Assembly, Honorable Minister of the Government of the Gambia, Diplomatic and Consular Corps, official from UN agency, national and international organization, distinguished invited, ladies and gentlemen. It is an honor today to participate on behalf of the Minister of Health of the Republic of Djibouti, Dr. Ahmed Roble Abdillah, in this great event launching the National Multi-Sectoral Strategy and Costed Action Plan for Non-Communicable Disease Prevention and Control in the Gambia. Allow me, Excellency, Mr. President, on behalf of the Minister of Health of Djibouti and his department, to convey to you the congratulations of the President of the Republic of Djibouti, His Excellency Mr. Ismail Omar Guelleh, and his government for the great progress made in the fight against the new scourge of the NCD in the Gambia. Excellency, Mr. President, ladies and gentlemen, in recent decades, an epidemiological transition has been observed in our continent, with the emergence of NCD becoming a real public health and having serious economic and social impact, thereby constituting a break of the desired development for our dear Africa. Thus, we face a double burden, that of communicable and vector-borne disease, which unfortunately still remain a major concern in all our country, but also that of NCD increasing from year to year. To this, and in collaboration with its technical partner, and particularly the Defeat-NCD, willing to strengthen national capacity and mechanism to fight against NCD. This strategy will help address challenge posed by this disease and improve Gambian population access to adequate care and above all better prevention. Excellency Mr. President, the Republic of Gambia and the Republic of Djibouti, each located at the two ends of this wonderful continent, Gambia to the west, bordered by the Atlantic Ocean, and Djibouti to the east, on the Horn of Africa, and in face of the Red Sea, shares both territorial and populational similarity. And above all, like a Gambia in Djibouti, we are increasingly confronted with the health burden of this NCD. The Ministry of Health of Djibouti has created within the Directorate of Priority Health Program a program to fight against NCD, with a view to also developing a national strategy like a Gambia, a nationwide epidemiologic survey of NCD and their risk factor will be carried out. This will be a stepwise survey following the WHO approach. In the fight against NCD, which will constitute, as predicted by all experts, the future health scourge of our continent, the experience sharing in a South-South collaborative approach is essential. Djibouti will try to benefit from the experience of your country gained with the development of this multi-sectorial national strategy. Excellency, Mr. President, the prevention and management of NCD must be included in primary care according to an integrated, inclusive, and multidisciplinary approach. Thanks to the leadership and involvement of decision making, it will require close collaboration on good coordination of the sector of
the agenda. But Your Excellency, before we move on to the next item, I also want to take the opportunity to recognize the presence of certain people who have been working very hard, tirelessly, day and night, here outside the Greater Banjul area and also within the Greater Banjul area. Since we started this document, they have been with us, and I want to recognize them. And they are Mr. Omar Baji and his entire team at the NCD program, under the Health Promotion Director, Mr. Baji and team. Omar Baji want to recognize your effort. Likewise, Dr. Joseph. Dr. Joseph is a consultant to the Minister of Health by Defeat-NCD. He has also been very, very instrumental. And Alhaji Mamadou Gassama of the WHO, country office, very instrumental.
Adama Barrow, distinguished officials from the Ministry of Health and from other line ministries in the Gambia, distinguished representatives from the Defeat-NCD partnership, development partners, patient organizations, academia and private sector, distinguished ladies and gentlemen. Diabetes and other non-communicable diseases have become the leading cause of death and disability worldwide. In the Gambia, which is experiencing a double burden of communicable and non-communicable diseases, NCDs account for 34% of total annual mortality. The overarching goal of the multi-sectoral strategy that we're here to launch today is to reduce premature death from NCDs in the Gambia by 1/3 by 2027. It is an ambitious plan, which is the result of the strong leadership of the Ministry of Health in prioritizing NCDs on its. More development partners will support the ministry in achieving its ambitious plan, as we all know that the challenge of diabetes and NCDs will not be solved quickly and requires persistent and continued efforts. On behalf of WDF, I once again wish to congratulate the Ministry of Health, in particular its NCD unit, for today's important milestone, which is paving the way for better NCD care and prevention for all Gambians. Thank you.
Thank you very much. Very powerful message. Now, policeman, I give you 5 minutes. The sweet one, you know the sweet one I'm talking about. Thank you. Some people are maybe sleeping, but I think they need to get awake now. Thank you very much for the concept. We now invite the Paramount Chief of Commonwealth to come forward. Paramount Chief Mohamed L.K. Bojang, who is also my dad. I welcome you here to come and get this strategy and costed action plan, give it to the Honorable Minister of Health, Honorable Ahmed Lamin Samate, and also tell him that you will also join us to the fight against NCD in the Gambia through community approaches. He will also take it from you and give us T-shirt to all the speakers. Thank you, Work for Health family. Thank you very much for the T-shirt gift.
Chief Executive, Defeat-NCD Partnership, Country Director, World Bank, Executive Director, World Diabetes Foundations, Director, Africa CDC, representative of the civil society organizations, religious leaders, members of the press, distinguished ladies and gentlemen. Air pollution. In the Gambia, we are told that NCDs account for about 34% of all deaths registered in the country. We must remember, however, that concern about non-communicable diseases is not about the number of deaths only. It is also about the drivers of these diseases. Like other developing countries, the Gambia faces numerous challenges linked to
It's happening.
It's unfortunate. I don't know. It's unfortunate. I always tell my friends that if we are coming back to this world, I will not come to the third world. I will come somewhere else. These figures are frightening, particularly when we a multi-sectoral approach, and this makes the NCD strategy a highly appreciated document. The consultative process involving different stakeholders, spearheaded by the Ministry of Health, was the best method to adopt. I commend the ministry and all the stakeholders involved in the process. It is certain that developing a document of this nature calls for huge resources, time, and energy. As a result, I convey profound gratitude to Defeat-NCD partnership and the World Bank for providing the much needed technical and financial support to develop these resources to prevent and control the undue spread of disease in the Gambia. I call on the Ministry of Health to coordinate and establish the necessary institutional arrangements and set the operational process in motion. I urge the Ministry of Finance also to help in mobilizing resources for the implementation of both the multi-sectoral NCD strategy and the action plan. In the same vein, we appeal to our development.
An action-oriented statement. And also the appeals that have been made with us, so they'll be implemented, inshallah. He has highlighted on key areas. The issue of multi-sectoral approach is the way forward. The use of the whole of government and the whole of society approaches is also the way forward. So therefore, the partnership will still continue until we see the Gambia NCD free, and it is possible with collaboration and partnership. On that note, I'm now taking you towards the end of this first session, which is just work, get advice from the COP where we get the photo. Ami Bojang, oh, the Director of Press. Sorry for not seeing, I didn't see you. I want to recognize your presence, my sister. Thank you. Meanwhile, we wait for them to check for the place for the photo. Policeman, the one you last gave, you remember before the president came in? That's good. Just give us that one. Yes, His Excellency can proceed to the VIP and wait for the arrangement for the photograph.
Yes, multi-sectoral. We thank the President for letting this event launch. We are indeed very happy. And as a journalist, we also have a role to play in the fight against NDC.
Okay. Good afternoon. You're not ready yet? Because I want to call Mr. Njai Modu, or Momudu, Njai of GRTS to come and take over the second session, which is a panel discussion with a topic on how to support and sustain the implementation of the National Strategy and Costed Action Plan for the Prevention of NCDs in the Gambia. And we have the panelists from the Minister of Finance and Economic Affairs, Minister of Health, Work for Health, World Health Organization, Defeat-NCD Partnership, and the Minister of Education, represented here by the Honorable Minister of Basic and Secondary Education, and the Minister of Trade and the National Health or National Insurance Scheme. That will be the panelists for the panel discussion. And then Mr. Njai will take over from here. Njai will come and take over the second session.
Thank you very much, Mr. Modu Njai, Director of Health Promotion and Education. Please give him a round of applause. It's a job well done. And from Modu Njai, Director of Health Promotion, to another Modu Njai. I am going to be your host on this part. It has been an exciting 2 days. Yesterday we were at Farato. Thankfully, it was a program related to the Ministry of Health with the launching of the eco-sterile facility in Farato. And today is another important launching of the National Multi-Sectoral Strategy and Costed Action Plan for Non-Communicable Disease, Prevention and Control in the Gambia, 2022 to 2027. So I say a big congratulations to the Honorable Minister of Health and all staff of the ministry. Please give them a round of applause. And now we move into action. I wish to reintroduce the members of the high table, starting from my far right is the WHO country director. Please give him a round of applause. Followed by the Honorable Minister of Health, Dr. Ahmed Lamin Samate. We also have a representative from the civil society organization, I'll skip, that is Honorable Serif Gomez. Please give him a round of applause. Honorable Claudiana Cole, Minister of Basic and Secondary Education, is also on the high table. We also have the CEO of the National Health Insurance Authority, Mr. Baima Sen. We have also the Defeat-NCD Partnership, their CEO, Mr. Bokul Bola. Please give him a round of applause too, and thank you for coming. Distinguished guests, I also want to introduce the committee to give us some brief insight on the impact of non-communicable diseases on the economy as far as his area is concerned, which is revenue and taxation. Mr. Yankubadawa, please give him a round of applause. You may remain in your seat, and we'll have a very heat-free panel. Thank you.
Thank you very much, Mr. Njai. I want to recognize the members of the high table, the ministers, and our delegates from other countries, as well as my colleagues. It's a pleasure for me to be here, even though I did not prepare to be on the high table, but I think I can take up the channel. The tobacco taxations, I would put my emphasis on that, used to be in the Gambia for a very long time. But during the past years, the way and the manner the taxations was done was really, really not something welcoming. And WHO, in consultations with GRA and Minister of Finance, years back, consulted us, and they explained to us that the way and the manner we were approaching the taxation of the tobacco was not what is the best considered as the best practice. And then at the time, I entertained the team, and they took us through the calculations and explanations of how we can work out the alternative. What is the alternative here? We used to do the taxation on weight. We said that the weight of the container, and then we look at it and multiply it by the number of cartons that are there, you know, and then we'll come up with the specific amount that's supposed to be the tax. And then the best practice then was to consider it by pack. When you do the taxation by considering the pack of the packets that are there, it is likely you will get it right, because it's difficult for anybody to change the way the cigarette is packed. So that was the secret. And at the time, this is way back in 2012, 2015, around that, we used to charge a container, a 40-foot container of a cigarette, around $1.5 million each container. And we realized that there was so much cigarette in the country. And this is not very good for the Gambia, in the sense that when the commodities are very cheap, it's simple economics theory. When the commodities are very cheap, it's affordable by everybody. But if the cost of the commodities are a bit expensive, it is difficult for the general public to be able to get it. And here we are targeting the youth. And the objective is that to use the new method of calculating the tax on cigarette, and which we sold the idea to Minister of Finance then. And when we sold it to them, they wasted no time. They adopted it, and then it went to the parliament, and it becomes a law that the cigarette should be charged on the pack rather than the weight. And that, at the time, made a significant difference of one container that used to be charged $1.8 million was then about 8-point-something million. So you can see the difference. From 1.5 million, it jumped up to over $8 million. So at the time, the results that we get was we have less importation, because the people who used to bring this who really cannot afford it anymore. So they had to resolve it, bringing less of the cigarette. And then on the contra, the revenue, tax revenue has jumped up to millions, if I can say even billions, if you check it for a period of a year or so. So it was really, we were able to achieve two things here. One, the very small amount of imports was coming into the country. At the same time, the revenue has gone up, but the main objective is it's make the cigarette very expensive to get. Those of you who smokes, if you find out the pack of cigarette now is very expensive, and we believe it is not easily affordable by our youths, and therefore a lot of even adults will decide, make an alternative. Do I have to buy a pack of cigarette, or do I have to go that $100 I have or $50 to buy credit for my mobile? And then this automatically has also contributed in improving the health situations in the country. And consequently, we, after discussions with Minister of Health, we thought that it is a good idea for the ministry also to have a portion of that collection we are doing, so that they can support whatever programs that they are doing. And as part of the annual recommendations that we do, because I am the Chief Revenue Advisor to the Minister of Finance, and on an yearly basis we do write before the budget speak to look at the areas there where we will make the recommendation for revenue measures to take place. The ministry will consider that and then take it up as part of the budget speak and take it to the parliament. So we do recommend that a percentage from the tax that we collect should be given to the Ministry of Health, so it can help them to achieve whatever they are doing. And we will continue collaborating with them in other areas. It has been mentioned by one of the speakers that we should look into other areas like the canned drink, the juice, and other sweetenings, that whether we could also work and see how we can increase the taxes on that so that the affordability will be difficult, and then as a result it will also help the country in terms of improving the health of this country, our people. Because we all believe that if you have a sick nation, productivity will be reduced. So we believe most of this sickness, I'm not a medical doctor, but you know, I know that most of the sicknesses that we are getting today, as already the Minister of Health has indicated, that we get it from the foods that we eat. So we have that bad habit of, you know, all of us, you know, have that bad habit of eating things that will, at the end, follow us health-wise negatively. So if you know those areas that really cause that, we try to target them and then try to use the law to make their taxes a little bit higher. It will reduce the volume of importation, and as well as we will achieve our objective by making sure that we have a healthy population. Good. I think more I want to proceed. I allow my colleagues also.
Thank
to
you very much.
Thank you.
I couldn't cut you short because your points are quite relevant to this subject, and I could definitely want to share that he wasn't actually prepared. He wasn't informed that he was going to be on the panel. It was Ministry of Finance that was supposed to sit, but by virtue of the fact that he is so proactive, we had to convince him behind the scenes to take that seat. But I could say he did justice to that topic. Please give him a round of applause. Now, it's actually a difficult task to, you know, balance the equation here. You have addicted smokers who, honestly, if you even have to make the pack $1,000 a day, they will still buy it. But then the Ministry of Health also have come up with different strategies to discourage cigarette smoking. Today, when you look at the pack of cigarettes, the first thing you observe is a health warning, isn't it? Smoking kills, but nonetheless, you still will have to smoke. So that shows you government is battling with a very difficult challenge. These are things that are really difficult to overcome. But thankfully also on the other side of revenue, CG has indicated that it has increased from $1.5 to $8 million in terms of revenue collection. So I could say that is also a big plus. So we're trying to equally save life, but also make money by saving lives also. So thank you very much for those improvements, Commissioner General. Now, to the Ministry of Health, there are a lot of emerging health concerns under your ministry, which day in, day out, you face this task on your table. And it keeps on coming, it keeps on coming. But then, what is the ability of the health system to respond to the challenge of NCDs and required multi-sectoral support, sir? Honorable Minister.
Yeah. Thank you very much, Ms. Sanjay. Distinguished panelists, ladies and gentlemen. Thank you once again for giving us the opportunity to participate in these discussions further. Now, of course, we've heard of the double burden of diseases in our communities, in the developing world, in low-income countries. Initially, it used to be the communicable diseases, but now the trend is shifting. We've seen a lot of non-communicable diseases. That's what we call the double burden. And in fact, we go further to talk about the triple burden when you also see the number of accidents, road traffic accidents, trauma-related deaths, disability, and so on in many of our countries. More so because some of the roads are not good. Sometimes our implementation, enforcement of the rules that are supposed to make the roads safe are not implemented to the best of our ability. And sometimes also the vehicles we get would have been old vehicles that are used to carry goods elsewhere. They come to our communities very old, and when they come, we transform them into passenger vehicles without any support. The interior of many of these big vehicles is all metal and some hard wood and so on. So if there's an accident, even those structures injure the people, and we get a whole lot of people in our communities that are very sick. So just from this introduction, it goes to tell you that there are a lot of things that affect the health sector that typically are not within the confines of the health sector. That is why the multi-sectoral nature of our work has to be emphasized. So we need the police, we need the road safety, we need the communities, we need the customs, GRA, even all these things, have to come together. And the drinking and driving also. Quite a lot of accidents, we are told, were by drunk drivers. Are we monitoring? Are we able to monitor those so much? They need to be monitored. That could save lives. And equally, it could help in the prevention of some NCDs by controlling the consumption of alcohol. Yes, we have a lot of challenges as a country. It's a developing country. It's a poor country. We don't have all the resources, and we try to maximize the resources that we have. We want efficiency. We want to ensure that there is value for money. How do we get that? We are trying to strengthen the systems, improve on the governance structures in the ministry, improve on accountability, transparency, and efficiency and timeliness of our services. We also trying to get health facilities to the doorsteps of the people. That's why the ministry has embarked on massive expansion, building new health facilities, upgrading, modernizing the current ones that are there, because some of these facilities are where these people with NCDs need to be seen. These people who have complications of NCDs need to be seen. But equally speaking, we also need to get the equipment. And the government has embarked on massive procurement of equipment, especially these past 2-3 years with the support of the partners, the WHO, the UN system, and so on, UNICEF and all the other partners, UNFPA, UNDP, and so on, have all been supporting in getting us equipment. Why are this equipment important? Because, yes, we could do advocacy. We could tell people, check your blood sugar, check your BP, but they get to the facilities and the glucometers are not there. So how do we deal with that? So we need the equipment. Now, so each facility, we've made it a point now, each facility should have basic minimum equipment. Each facility must have a glucometer, should have oxygen concentrators, should have thermometers, should have pulse oximeters, and so on, weighing scales. Because if you want to tell people they are obese, you cannot even get their BMI, you cannot weigh them, you cannot get their height. How do you even know they're obese? Then you see somebody that you don't like the person's looks and you just call him obese. These are supposed to be scientific and then measured, and then they can be advised. Yes, there are a lot of capacity gaps, because even with that, we do not have many dietitians in this country. So the dilemma is people come, they have diabetes, what do they eat? But what they eat is not what is written in the books elsewhere. It has to be related to the food we have in the Gambia. Then what do we stop them from eating? Occasionally, we virtually starve people by not giving them the right information. Don't eat this, don't eat this. But what should they eat? So all those information have to be put together to them. But equally speaking, even the complications, if you do not have ECG equipment, in a health facility, now, a person who probably has early signs of a heart disease, you may not be able to detect it because those equipment are lacking. So that is why the government has embarked upon procurement of all this equipment, so a lot is being done, but the resources are not there to do it across the length and breadth of the country. That is why we are launching this, so that we can get enough resources to ensure that each facility is able to provide the basic screening tools for these NCDs. Cervical cancer screening. Many of these women come very late, and cervical cancer is the leading cancer in women, is the leading killer in women in this country. But it is also preventable by the HPV vaccine. So the sensitization of the communities for people to take those vaccines is important. Now, but the screening of the precancerous lesions is very important. When women are screened, they either go through the thermal therapy or the cold treatment, cryotherapy, and that alone ablates the precancerous lesions, preventing that woman from developing cervical cancer. So you see where the strategy is directed. Breast cancer, you've seen that there is a percentage that's supposed to be dedicated for the control and prevention of breast cancer. So breast cancer screening is very important, the clinical screening, the mammography, and so on and so forth. So typically, yes, the strategy we are launching today, or His Excellency has already launched, actually sits right into our health policy and the general health strategy. So it is fitting in. And you heard when we were discussing, we did mention integration. So it's not a standalone. We're going to be integrated in the whole system. So thank you for the time being. Yeah.
Doctor, thank you very much for doing justice to the topic. I think left to me alone, I could have left him to speak during the whole panel because everything made sense, but we had to just make it in brief. I just want to remind ourselves with some of the few things Doctor had said with regards to having resources. I think this is very important, and we need to recognize that health is a lot of money. And equipment costs a lot of money. To have an effective healthcare system, we must have the right equipment, like he just said. And to get the right equipment, we must have to get also the fundings to be able to buy some of these equipment. Mentioning some of those also reminds of sometimes certain diseases, how challenged sometimes the ministry is to be able to detect some of these diseases because of lack of some of those equipment. So you could see that the ministry is doing everything, but I always say this: if I had my way, I could say 80 to 90% of the budget will go to health, because I can say this is the backbone of this country. A healthy person is a healthy nation, and thereby we move to other sectors to progress. Because if you go to work sick, you become unproductive. If you go to the factory sick, you become unproductive. If you wake up, you're not feeling well. To be honest, you don't definitely contribute your quota to national development. So a healthy nation is quite important for that. So, Honorable Minister, I think it's important that all sectors give the maximum support to the ministry. Thank you very much. Now, we move on to a civil society organization, and this time I will invite Work for Health, Mr. Sheriff Gomez, Honorable Sheriff Gomez, who is the national coordinator, to speak on the role of national society organization in the implementation of the NCD's strategy of the Gambia. Mr. Sheriff Gomez, please.
Thank you very much, Mr. Moderator. I'll observe the protocols. Honorable Minister of Health, Honorable Minister of Education, distinguished panelists, ladies and gentlemen. Mine, from a civil society point of view, specifically the group I lead, the Work for Health initiative. And it didn't come out of goal status creation. It is a passion that I have always been in, exercise and keeping fit. Anybody who knows me knows that this is part of me. And over time, we had always been out exercising. Anytime you pass a community, you'll see or hear somebody saying, "Oh, I wish I could join you. Oh, I wish I can have the time to do this." So from that perspective, I and my colleague, Mr. Diba, who is on the floor, thought that it would be good at some point to come together and inspire people to get up from that, "Oh, I wish you can take me along. Oh, I wish I have the time." So do we inspire this type of people to come out and exercise in group? And that is why our motto is one for all for one. Because it is through this that we believe. I know I can at least vouch that for many people, I can vouch that I am fitter than many people because I am always on exercise. But it would be great, it would be best to have a whole community that can claim I am fit too. Because your fitness is only related to national development as much as it is related to how fit the community you live in. And this inspiration is what we believe we should always take forward to the communities. So for us, this is how we started initially Work for Health. But Work for Health went long time ago. When I was the Minister of Youth and Sports, my quest was that apart from sports for excellence, we must also champion sports for, mass sports, to enable people to be healthy and enjoy their lives. And that was why we started, myself and the then Minister of Health, Madam Fatim Baji. We even championed and initiated the offices to start dedicating a day in the month to come out and do some exercising. And I think this is what we had started at the time. In my out of office from ministerial, from cabinet portfolio, on my personal level with my friends, I thought we should be organizing this. Our objective is just this, to help people, to inspire people, to motivate people to come out and do exercises. Now, tie this to this driver of NCDs, one particularly, which is inactivity. And our quest have now been driven now to ensure we play a part in driving this country to fight NCDs through maximum exercising, through removing inactivity in our calendar. Our vision, of course, I have always interacted with the Minister of Health, is that our vision for Work for Health is to be able to open a chapter in every town in this country from Banjul to Kaina. And together we will all be dedicated towards exercising, towards uplifting, because if you do this, you reduce your medical footprint, and through this, the national medical bill goes down. But most importantly also, if you have a nation, no matter what projects you have, no matter what development agenda you have, if you don't have your people to be healthy, that development goal is useless, because your people cannot lead, cannot help you with that development. And it is this Gambia and its citizenry that must be at the forefront of developing this country.
Thank you.
If we are not healthy, we cannot do it.
Good. If we are not healthy, we cannot do it. Thank you very much, Honorable Sirif Gomez. But I just want to also add that, Honorable, I think I've seen you a couple of times, doing some exercises around Bakau and environment. And I also want to add that sometimes a lot of people in suits, don't underestimate them. Sometimes they leave office have time for themselves and do some exercise. So I want to implore on all of us, including myself and everybody, to create time and do exercise. It's very important. And I always say, just quoting a quote from what Honorable Gomez said, that some will say, I wish I have time to join you. But it is a fact. When disease struck, honestly, you will have time to go to the hospital. You will have time to go to the hospital. So I think there is an old adage, it says, prevention is better than cure. I think we all have to live by that mantra to also help Ministry of Health with the too much of burden that they carry. At least with our little exercises, keeping fit, will also help them redirect some of those funds to other sectors. So I think, above all, attitudinal change is also very important. The food we eat, it also has a lot of ramifications on our healthcare itself. But also to add that checkups also, I think generally Gambians fear going to the hospital and do checkups. It's a very rare circumstance. You see people voluntarily, probably nothing happens, but you just have to go to your hospital on a routine basis to go and do bodily checkup for some 1 or 2 minutes or few minutes like that. I think it's important, and those kind of activities are encouraged for people to take their responsibility themselves. Now, the Defeat-NCD partnership has been a long partner to the Ministry of Health, but I think at this stage I will invite them to share with us the role that the Defeat-NCD partnership have played and will continue to play to support the implementation of this important strategy and its costed action plan. So I invite the Defeat-NCD CEO. Thank you.
Thank you. Indeed, not such a long partner, a year and a half, time flies. But Gambia has a long-term commitment towards attaining Sustainable Development Goal 3.4, which the WHO representative earlier alluded to, reducing premature mortality from NCDs by 1/3 by 2030. And already that initial timeline of 2030 is the long-term commitment that the Defeat-NCD partnership has made to the Ministry of Health and to the government of Gambia and the people of Gambia. We are a public-private people partnership which was launched at the United Nations in 2018, anchored in the United Nations but extending beyond, because we realize that we cannot do this without the engagement of civil society, of private sector. Investment has to come from private sector as well as international aid is going to be catalytic, but it's not going to solve all the problems. So I think in terms of what our role is, we're not an advocacy organization, and I think this was something that the Minister of Health appreciated when I first met him over a year ago. He said that, I'm happy that you actually put specialists, not generalists, to accompany side by side inside the NCD department, which in most countries, by the way, in low resource settings is only one person, handling so many files. So you put a health financing specialist, a forecasting specialist, supply chain specialist, public health specialist, health economist, depending on what the need is. And you don't just come in and fly out and do a document and get out. Actually, it's very telling. This document is not just the Ministry of Health's document. It is a national multi-sectoral strategy, which has had extensive engagement across all parts of government, and the President himself launching it. So this is really certainly not Defeat-NCD's work. It's the Ministry of Health in collaboration with all partners. And I think that's very important for the success of it. What our role is going to be, so till now, over the last year and a half, we have contributed towards Pillar 1 of our 4-pillar strategy. That is providing direct operational support to NCD departments, working under the norms and standards of the World Health Organization and the guidance of the ministry. The next step in this has been very clearly mentioned already by the Minister of Health in his remarks earlier today, where he says that in his presentation, the National Multi-Sectoral Committee, he would like the Defeat-NCD partnership to be supporting MOH in running that and ensuring that we remain on track. Of course, the technical working committee under Pillar 1 with the WHO's support and Ministry of Health leadership will be also contributed to. Under Pillar 2 of our approach, we look at how can we engage health entrepreneurs in terms of pushing some of these technical solutions towards improved self-management, self-care. Honorable Minister mentioned, equipment, glucometers. It's a very inexpensive tools sometimes, but if we don't have access to them, my father's a diabetic. He doesn't have to go to a hospital, to a nurse to manage his own diabetes. It's a chronic condition. There are tools available where we can manage this ourselves and thereby remove the burden from the health system already. So we're working with entrepreneurs to try and scale up some of these solutions in countries, in communities, so that we can diagnose and screen patients that are currently not diagnosed, for example. And then, of course, it would be immoral to just diagnose patients and not provide a solution, Honorable Minister mentioned equipment, but there's also medicines. And in that regard, the Defeat-NCD partnership under our third pillar has established an essential NCD supplies facility, which looks at aggregating demand across many countries and pooling together forecasting in order to get deals with manufacturers of these very expensive equipment. Some of the ecology equipment and diagnostic equipment is very expensive. And if a small country relatively procures only a few of them, then its economics is going to tell you that we're not going to get the best deal for the population or for the government. So this is why pooling the procurement requirements and actually supplying those to both public and private sector is, I think, one of the biggest contributions I think that we may be able to make in reducing the costs and ensuring quality treatment is available to populations.
Exactly.
Because
Thank
without those quality treatment, people suffer from counterfeit medicines, you know, and substandard care, which is unacceptable.
Good. Thank you very much. Mukul Bola, Defeat-NCD CEO, thank you very much for that. Now we move to the best practices, and the WHO country will be talking on that. Let's now call on the WHO country representative to talk about best practices that will be applicable in the Gambia to address NCDs. We have always talked about NCDs, but now let's hear from the WHO chief in the Gambia to talk about this. Thank you.
Thank you very much, moderator. And I would like to recognize also protocol, respect the protocol. Thank you very much for this opportunity. I think I will be just highlighting what Honorable Minister was presenting to us early in the morning. I will just try to put it in with perspective of how it came into picture. In the NCD prevention and control, we have about eight interventions, you know, that have been identified to be very good to implement. But as you know, always what we want to do and the resources are not always balanced. So we have to choose which ones should we implement first. And to do that, there were two criteria that were applied. One is the evidence, demonstrated evidence that this approach will work. If you have that, it will be prioritized as the first one. The other one is about its relationship with the SDG targets. So using that, those criteria, it was possible to narrow down to 16 the best, what we call now the best buy, which is very easy for people to understand. Which one should you buy, this computer or that one? The price could be the same. Which one will give you a better output? So that type of comparison. So the 16 interventions have been identified. And these interventions, you know, cover 4 key risk factors, which we have been talking about this morning, and 4 NCDs that are actually contributing the most of the problems of NCDs. These are actually, if just risk factors quickly: tobacco use, the harmful use of alcohol, unhealthy diet, physical inactivity, and when it comes to the NCDs, we have also the cardiovascular diseases, diabetes, cancer, and chronic respiratory disorders. So if I just can highlight for you briefly, tobacco, we have been talking about tobacco. One of the demonstrated results that we have seen in Gambia is increasing the excise tax and the prices of tobacco products, which is working very well, as you can see, because it's evidence-based. And standardizing the packaging to make it less attractive, which was also highlighted. Banning advertising is another, and also promotion and sponsorship. Eliminating also exposure to second-hand smoking. If you see now, I think some of them may not really comply strictly, You cannot go to a restaurant and smoke. It's not allowed. It will be illegal. So these are the interventions just to, and then educating the public. The harmful use of alcohol can be also reduced through the same measures that we have used for tobacco, like putting excise taxes. That will really help to reduce the use, but at the same time increase our revenue, which can be used also to support these activities that are against NCDs. Enforcing bans and enforcing restrictions for the physical availability of these products. In some countries, they restrict availability during working days. You cannot buy alcohol, or over weekends. You cannot buy alcohol. After hours, it will be closed. So you limit, you constrain this so that people will not have easy access. Unhealthy diet, I think one of the culprits is salt here. Salt is one of them. So reducing salt intake and using different measures like restricting in the packaged food percentage of salt that you have to put, or maybe no salt, and reducing also intakes through.
Let's try as much as possible to also help ourselves before we are helped. Now, I invite now the Honorable Minister of Basic and Secondary Education, Honorable Claudiana Cole, who will speak on the importance of knowledge and healthy habit building that schools can have to protect the nation from NCD risk factors. Honorable, please give her a round of applause.
My teacher voice. Do I have to use two? Both of them? This one is already on. Yeah, thank you. Thank you very much, Mr. Moderator. Yes, I observe that I'm the only female among the panelists.
That makes you stand out. Please give her one more round of applause, please. Thank you.
My colleague panelists here at the high table, ladies and gentlemen, all other protocols observed. I'm not very comfortable, actually, with the fact that I am the only female among the panelists. And the reason is that the topic we're discussing, non-communicable diseases and its effects and consequences, the brunt of that is borne by females. Because when people are sick, family members, it's the females who are usually engaged with taking care of them. It's the females who will prepare the special diets. It's the females who will be responsible to be going in and out of the hospitals. It's the females who spend a lot of time looking after their sick family members. To the point that sometimes those females, even if they're working, they will have to forego their work, whether their own private entrepreneurship that they do, or even if they are civil servants. Right now, I know of a lady, a senior education officer, who has taken excuse from work for the past 6 months just to look after a sick spouse. So you see, it's the females who usually bear the brunt. But nonetheless, I'm the only one among the panelists here. I'll speak on behalf of my fellow females. And ladies and gentlemen, health, they say, is wealth. And a healthy nation can be considered as a prerequisite for national development. Some of the speakers made mention to that. In fact, some of the speakers have already mentioned some of the points that I wanted to, that I had down to talk about. But then it shows how we are all thinking alike. We are all very concerned about this important topic. Therefore, for any country's development, the health of its people is reasons why in education we talk about catching them young. Catching them young. In our schools, we want to give our students early information. I could remember when I was in primary school and we were doing, we used to have on the timetable what we called health education. And some of the things they taught me at school, I would go home and I would want to teach my old grandmother. Sometimes I would tell her certain things are no longer good and should be thrown away. You know, my grandmother used to preserve fish for the rainy season. In those days, things are much better now. In those days, it was really, really tough during the rains. The markets were almost virtually empty. And she would preserve some salted fish. And oysters and things like that. And because it would have been kept, and then you would see something like mold, white on them. And when she tells me, go and bring that oyster, go and bring that fish, when I'm helping her with the cooking, when I bring it, I would say, Grandma, this is no longer good. And she would say, put it down. And then what would she do? She would take hot water, pour it on it, you know, and try to wash it well, prepare it before she cooks. But then I was using my knowledge from school to try to educate her. But I was not very successful. She knew better. Now, we talk about catching these young people, these students young. We want to give them the information at the young age while they're in school so that they grow up with it. They usually say you cannot teach an old dog new tricks. So teach the dog the tricks when it's young and it grows up with the tricks and becomes a very good dog. Those of us who have pets. Young as the future leaders may be, they must be well prepared. They must be prepared physically, mentally, emotionally, and psychologically for their future roles and responsibilities. They must be equipped with the education, the knowledge, and skills that would make them maintain a good health and state of well-being. Hence, in our schools, we have health talks with our students to educate and keep them informed about health issues. We also have peer health clubs in schools where health issues are discussed and are also dramatized to reinforce the information and the education that we want the students to have about the effects and consequences of bad and unhealthy health habits, such as poor nutrition, smoking, harmful use of substances, alcoholism, etc., etc.
Thank you.
That could cause NCDs. And we're in an education session.
Exactly.
That's what we're in. So perhaps
I'm afraid you might turn it into a classroom. Please give her a round of applause. But I can give you extra minute to wrap up, please. Just an extra minute, please.
Okay, let me just complete.
Yeah.
So we need the education. We need the education. We need to educate our young people. There is need, therefore, to act now, to act on time, and also to act together. Health promotion at school level is necessary, and the collaboration that already exists between the Ministry of Basic and Secondary Education and the Ministry of Health must be strengthened for effective prevention of NCDs among our young people. I would like to inform the Ministry of Health that my ministry is always ready to work hand in hand with them and other partners to prevent the risk and spread of NCDs from unhealthy habits, poor lifestyles, or other practices among our students and young people in order to enhance their well-being. Please, Ministry of Health, be assured that we are together with you in this journey to defeat NCDs and will implement our share of this strategy for our country's development, progress, and prosperity. I thank you.
Thank you, and thank you so very, very, very much. Ladies out here, please rise and give her a big round of applause, please. Please, let's all rise and give her a big round of applause, please. You may take your seats. Thank you very much. I hate to be given a specific time for panel discussions because most of the topics that are being dealt with, experts come with very, very relevant points. But as a matter of time, we need to just be concise on that. But back to the Honorable Minister's points, I have noted some few points, and she just said that we need to act now, and we also need to act on time, and we need to also act together. But I will also want to share that there are a lot of young people now who have developed NCDs at a very early age. And I think this is a very serious cause for concern, both for the ministry and even the entire country. I remember when we were younger, around primary school, I used to be at Cervical Primary School and lived at Canifing Estate. Every day, early in the morning, I walked from Canifing Estate all the way to Cervical School without any car. When I closed to school, from school, I walked back from Serakunda, deep inside Serakunda. Anybody who knows Serakunda School will know where Serakunda School is. And I would walk back home every given day, year in, year out. And I did that. Not to say that all children have to walk to and from school. No, we have passed some stages where you have vehicles. But sometimes it's important that children develop the habit of learning it the hard way at times. You know, walking, playing football, doing sports, and engaging in exercises. Otherwise, they become unhealthy at a very early age. So I think it is important that this kind of syllabus and activities are also encouraged in schools. You have PEs in schools, also physical education. And it is important, like the Honorable Minister said, that we have to catch them young and give them early information on some of these subjects. So thank you very much. Please give her a round of applause once more. Now, the National Health Insurance Authority is being ably represented by the CEO, who is by Mastal. I'm sure a lot of people will hear about National Health Insurance Scheme, but there is an authority that is responsible for this. And he is no other than Baimas Sen here with us. But in just a few seconds, I just want him to talk about what the NHIA does, and now he will talk about insurance for NCDs, for non-communicable diseases, between ambitions and implementation in reality. How can NCDs be financed and sustainability? That's very important. Mr. Baimas, please give him a round of applause.
Thank you very much, Mr. Moderator, Mr. Njai. I recognize the distinguished panelists. I also recognize the distinguished ladies and gentlemen in the floor. Briefly, what is the NHIA? The NHIA is the corporate body set up to promote universal health coverage for all Gambians. You've heard various scenarios, but imagine the population suffering from NCDs and not being able to afford healthcare, to afford the drugs. Now, healthcare is very expensive. If you understand, okay, I didn't want it to echo. Okay. If you understand NCDs, they can be very chronic. Take, for example, diabetes and blood pressure, high blood pressure, which are very common in our society. If you are an employee, your employer takes care of your insurance. But imagine the rest of the population who are unemployed. Who takes care of their insurance? If you suffer from diabetes and high blood pressure, and you can't afford it,
that's almost like a death sentence. This is where the NHIA comes in. With pools of resources from government, the NHIA will be able to provide insurance for all Gambians. Where are we now? You have a low population of Gambians with insurance coverage. But even if we're able to achieve 70% of health coverage for Gambians, that's an achievement in the first 2 or 3 years. I think some countries have done it successfully. We've got the examples of Rwanda, Kenya, and closer to our country, Senegal and Ghana. Now, I'll give another example. Even for us who are employed, when you go to get health insurance, the first thing they'll ask you is, do you have a pre-existing condition? Now, this is where the question comes in. How does NCD impact health insurance coverage? It makes it very expensive. Now, guess what? If you make the mistake of answering yes to that question of pre-existing condition, you either get a flat no, the insurer says, I can't insure, or the premium goes up. So now you can see the role of the National Health Insurance Authority is going to be very key in making sure that Gambians with existing condition or without existing conditions are provided with coverage. Now, the drugs can be very expensive, but it's not just about drugs. For some of them, the conditions are so bad that they need expensive surgery. This is something you can pay out of pocket, and therefore, the NHIA has to come in. Even with the private insurance, it's very expensive. So, where are we now? It is a newly established body. We are currently focused on recruitment of staff. We're getting the authority on the ground, and hopefully we'll begin with the launching of the mass birth certificate registration, August 6th, with the support of the Minister of Health and the President. August 6th, we should be somewhere in the Gambia, hopefully in Brikama, to launch the mass registration of the birth certificates. Sorry, I can't say all. Yes. But that is the idea. Most insurance providers will not they will not insure people with NCDs because it's too expensive. And since the common man cannot afford it, the NHIA is very crucial in making sure every Gambian is covered.
Thank you very much. The NHIA will be very crucial in this together. Thank you very much to all the panelists. Now we've wrapped up the panel discussion on this side, and the mic will be given to the floor now to the audience. This is the Q&A part, and it's a very interesting part. I like moderating. So be very free and relaxed. If you have any questions to the panelists, you may ask this question, and I will have the mic given to the audience. So you may just raise your hand up if you want to make a question or you have a comment. Do we have one? Good. We have a lady first. Please give her a round of applause. So I will come over to you and give you the mic. You may speak.
Good afternoon. My name is Sally. I am a journalist. My question was inspired from Mr. Dabo's discussion. And it is very good that you've put up these measures to control the coming in of tobacco. But we've seen in recent time how businessmen turn to become heads of a movement, massive movements that are part of organized crimes such as smuggling. If these measures are put in place to control the importation of tobacco through our seasons, my worry is how do we control tobacco that is being smuggled into the country? Thank you.
Good.
The tendency is they will lose those commodities as well as penalties will be charged on them. Thank you.
Good. Excellently responded there. I think CG has rightly said it. Smuggling has been there for time immemorial, and the authority cannot patrol the length and breadth of this country 24/7 non-stop. Our borders are also porous, remember, and people have always, cunning means of getting into this country, at times that you cannot even control. But at the end of the day, there are very serious punitive measures that the authority have set for those offenders. Thank you, CG. Now, do we have any other comment or contribution from the audience? Any comment or contribution from the audience? Yes. Like I said, short and precise, please. Thank you.
Good afternoon to colleagues. My name is Paul Bass, the senior lecturer and head of department of public and environmental health, University of the Gambia. This is a very interesting conversation that we're having around NCDs, but for me, it's just disheartening that one thing that's not mentioned here, and which I think is very important and very crucial as far as NCD is concerned. We talk about inactivity. I have a friend who will do all the kind of work you think of, exercise. Probably you burn 2 calories, you come back home and take probably 10 calories. I'm a vegetarian, I practice vegetarian. And I suffer, anywhere I go, I suffer. If you write in this place here, when I go for breakfast, and people look at me like a strange person. You go around most of the restaurants, people look at you as a strange person. And this is something that we need to encourage people. Diversity in diets is very important. For most of us who have been to Asia, discover that life expectancy in that part of the world is very high. Basically, most of them are vegetarian. But not only vegetarian, but a lot of other things that, come into play for to enhance their longevity. But I think it's very important as Gambians, and I think we're supposed to start discussing with people in terms of diversity in diets. And I think one of them could be vegetarian diet. Yeah, that's my case.
Good. Thank you very much for that contribution. In other words, I think I may not be a health expert, but that, in other words, is just talking about a balanced diet. I think that is very important. We also have a contribution somewhere. Mr. Baj.
Yeah, thank you. Thank you very much, moderator. I also want to join colleagues to commend the Ministry of Health under the leadership of the Honorable Minister for this very important initiative. I want to make a comment on the effect of traditional medicine on NCDs. I think that is also an area which is playing a part in terms of the challenges relating to NCDs. We know traditional medicine works. It is recognized by WHO. But I think in the context of Gambia, we need some form of regulation. The most common advertisements you hear on radio today is not on HIV, it's not on NCD, but it's largely on traditional medicine. And
Taxations. So that combination makes it difficult to control. But nonetheless, governments are trying. WAHO, West African Health Organization, has developed the first pharmacopoeia recently, and we hosted a WAHO-wide traditional medicines meeting sometime last year. So a lot is being done with regards to regulating the practice of traditional medicine. And when it comes to regulating practice in the Gambia, it's not just traditional medicine. We also started regulating private practice in this country. Private facilities, I'm sure you'll all be surprised to know that what we inherited as a government, there's no regulatory framework for setting up private clinics in this country. But we started. You can imagine, anybody could virtually get up and set up a private clinic. Well, we say that cannot happen. So we are regulating that. They're going to have a licensing registration framework and annual licensing regime that all private facilities will have to go through. And by doing so, they will also be limited to where they have an advantage. Not just you have a private facility and they tell you they can do virtually anything. No, they'll be limited. And the CEO of the National Health Insurance Authority is here, and they are going to also recruit the private facilities and the public facilities in the insurance scheme. But the advantage is that they're going to have very strict guidelines that each of these facilities is going to follow. And that means for them to participate in the National Health Insurance Scheme, they have to be up to standard with competent people and so on. So the issue of advertisements on the media on traditional medicine is being looked at by the Medicines Control Agency, and the Directorate of Health Services and the Traditional Medicines Unit, they need to strengthen that. But Mr. Baji, it also says a point. It also says a point that the traditional medicine practitioners are doing a better job at letting people know about what they do than you people at the NCD department. You should overtake them. You should tell people more about the NCDs. You should tell people about the risk factors. You should tell people a whole lot of what they should do and what they should not do. So what I'm trying to say is, at the ministry, we need to look into our communication strategy so that we inform people using the same tools, the same media, radio, television, journalists, community leaders, so the message gets across to the people. Thank you.
Thank you very much, Honorable Minister, for the response. I think he has said it all, but one thing that I just stole from him was the fact that I think we're honored that the ministry is establishing for the first time a unit to regulate facilities. I think this is really laudable. So congratulations on that, Honorable. Please give them one more round of applause, please. We for far too long needed a system in this country as far as healthcare is concerned. And I think the ministry for the past 5 years have been on the right trajectory as far as that is concerned. I know it's a challenge, and we must have to accept that it is a challenge to be able to overcome all obstacles, and inshallah I think we will get there. Now I will just take one or two.
Why we may lose people that we care about, but also how the government can help prevent all of this. So today we learned about the importance of strategizing and planning and preventing and making the world a better place. So I also have a question for the Honorable Minister of Health. Have you thought about developing